Opening prayer. Thank you, Lord, for this meeting and the purposes you set forth. We know that you are always with us when we gather together, such as today. Even in failed attempts, you blow us away with your faithfulness, and we humbly come before you again to ask for your divine guidance and assistance so that this meeting will bring about the changes in the country that we need. This we ask in Jesus' name, amen.
Thank you, Comsec. Next is the calling of the roll.
Mr. Chairman,
Yes, Honorable Cruz.
I move to dispense with the calling of the roll.
There's a motion to dispense with the calling of the roll, duly seconded. Hearing an objection, the same is approved. Next is the approval of the minutes of the previous meeting.
Mr. Chair, I move to dispense with the approval of the previous meeting.
There's a motion to dispense with the reading of the minutes of the previous meeting and the approval of the same. Duly seconded. Hearing an objection, the same is approved. At this point, I'd like to acknowledge the presence of our members of the Committee on Health. Honorable Jude Asidre, Deputy Majority Leader of Tingog Party List and one of the authors of the bill that we will be deliberating upon. Honorable Ricardo Cruz Jr. of the 1st District of Taguig Pateros. And Honorable Khymer Adan Olaso of the 1st District of Zamboanga City and one of the authors of today's deliberation on the bill. Thank you very much for your presence. Comsec, please acknowledge our resource persons this morning.
Thank you, Mr. Chair. Our resource person for this morning, for the bill on assisted reproductive technology and surrogacy, we have from the DOH, Dr. Mary Rose Argente, and Dr. Lida Ranyola from the Jose Fabella Hospital. From the DBM, we have Ms. Julia Micaela Dominiano, Budget and Management Analyst. From the PhilHealth, we have Dr. Adeline Messina, Medical Specialist. From the Philippine Society of Reproductive Medicine, with us is the President, Dr. Debbie Packing Songko, and past President, Dr. Virgilio Noveru Jr., and also past President Dr. Romerico Torres. For the bill on clinical trials, from PhilHealth, again, Dr. Messina is here. From the Pharmaceutical and Healthcare Association of the Philippines, with us is the President, Dr. Diana Edralin. The trustees, Ms. Lotis Ramin, and the Healthcare Policy Director, Ms. Daisy Sembrano. From the Philippine Clinical Research Professionals, Inc., we have with us members, Ms. Jennifer Arellano, Mr. Rodmar Pulido, and Mr. Conrado Vidal. That's all for now, Mr. Chair.
Thank you very much, Comsec. May I just read the brief opening remarks from the Chair. Good morning once again, distinguished members of the committee and esteemed resource person. In the agenda of today's meeting are two bills that shall regulate the use of technology in the delivery of healthcare services, namely assisted reproductive technology and surrogacy, and the conduct of clinical trials. Assisted reproductive technology, or ART, has been performed in the country for years, but the data present are just underestimates because there is no official registry for assisted reproductive technology. Moreover, though surrogacy is also done in the Philippines, the issues of parentage and children's and parents' rights need to be addressed. Hence, the need for a law regulating these procedures that shall, at the end, protect both the health and the rights of Filipino parents and children. Moreover, for the state, more affordable and wider array of medicines there is a need to look closely in the present regulation on clinical trial activities. There is a clamor to improve our access to innovative medicines by assessing and redesigning the present clinical trial system, and possibly by establishing a center which shall serve as a pharmaceutical hub for medical research and development. So we shall now tackle the first bill, the bill on clinical trials. So we now call on the author, Honorable Jude Asidre, to sponsor House Bill number 8301, entitled An Act Providing for the Framework for the Conduct. No.
Accelerate.
No, the bill, House Bill number 9867, entitled An Act to Accelerate the Discovery and Development of Innovative Medicines by Strengthening Clinical Trials and for Other Purposes, by Speaker Ferdinand Martin G. Romualdez, Honorable Yeda Marie Romualdez, Honorable Jude Asidre, and yours truly. Honorable Asidre is now recognized.
Thank you, Mr. Chair. Honorable Chair, dear colleagues, members of these committees, ladies and gentlemen, good morning. It is my honor to sponsor before this committee an essential piece of legislation that aims to change for the better the landscape of medical innovation in our country. House Bill 9867, otherwise known as an act to accelerate the discovery and development of innovative medicines by strengthening clinical trials and for other purposes. In the midst of a world where health challenges are constantly evolving and new diseases emerge alongside all adversaries that continue to afflict our population, there is no greater task than ensuring the well-being of our citizenry through the advancement of medical science. It is our responsibility to foster an environment where the discovery of groundbreaking treatment and cures can flourish, not merely for the benefit of our people, but for the betterment of mankind. This bill before us seeks to address several critical barriers that have historically impeded our nation's ability to conduct clinical trials swiftly and effectively. As we stand, our clinical trial infrastructure faces challenges such as bureaucratic red tape, the lack of funding, inadequate facilities, and a shortage of trained clinical researchers. These obstacles have not only slowed the pace of medical advancements, but have also deterred international partnerships and investments that are vital to our progress in this domain. The proposed measure lays out a comprehensive framework to support and enhance our clinical trial ecosystem through the following measures. First, establishing a centralized authority to oversee and streamline clinical trial application and approval process, reducing unnecessary delays while maintaining stringent safety and ethical standards. Second, increasing government funding and incentivizing private investment in clinical research, thereby enabling the development of state-of-the-art trial facilities and the adoption of innovative research methodologies. Third, creating training and development programs to build a skilled workforce of clinical researchers, data analysts, and trial coordinators, ensuring that our human resources are on par with international standards. Fourth, fostering public-private partnerships to share knowledge, resources, and expertise, encouraging a collaborative effort to medical research that benefits from the strength of both sectors. Fifth, ensuring patient safety and informed consent remain paramount by implementing robust oversight and transparent reporting mechanisms throughout the trial process. By enacting this bill, we will not only expedite the development of innovative medicines, but also position our nation as a global leader in clinical research. This will have far-reaching implications for our healthcare system, our economy, and our international standing. A robust clinical trial ecosystem attracts global talent, creates high-value jobs and stimulates the economy through research and development activities. Moreover, it ensures that our patients have early access to the latest treatments, often providing life-saving options for those with few alternatives. In conclusion, I ask my esteemed colleagues to support this vital measure in the spirit of progress and compassion to ensure that our country can rise to the challenge of fostering medical innovation. By passing this bill, we will be setting the stage for a future where diseases once seemed insurmountable can be confronted with the full force of the human genius and our collective action. Thank you for your attention, and I look forward to a productive discourse on this measure. Maraming salamat po, Mr. Chair.
Thank you very much, Honorable Asidre. We now listen to the position of the Philippine Council for Health Research and Development, Ms. Rachel Mendoza.
Hello. Good morning po, Mr. Chair. So, we are in support po of the bill. However, it should be noted that the DOST is currently supporting a program being implemented by the University of the Philippines under the National Institute of Health, National Clinical Trials and Translation Center, or the NIH NCTTC. So the NIH and NCTTC envisions po to be the hub of excellence for clinical research in the Philippines, and it will be the major resource facility for health research and capacity building, creating new knowledge that changes the standards of healthcare for Filipinos. Specifically, this will be achieved through the following. First, the provision of a central hub for human clinical trials, particularly human resource education and training for principal investigators and research staff, clinical research operations, data records management, quality assurance, and assistance in the clinical trials set up in different areas all over the country. Or this clinical trials po that will be set up is they envision to be a regional hub din po. So, this may be in overlap po with the bill.
Are you saying that right now the UP, the PCs, CHRD, and NIH are the ones in charge of the
Establishing po center.
The approval for drugs for clinical trial?
Actually,
Right
Mr.
now?
Chair, the projects are currently ongoing, so they are still establishing the center.
So it's still establishing. So it's not yet established.
Yes po, sir.
So sa ngayon, sino ang in charge?
Currently po in the PCHRD under the Tuklas Lunas program, there are two projects po for the clinical trial research. So they are conducting a clinical trial research for two different herbal medicines po.
So you are saying, for the past several years, wala pang established na body that is in charge of these clinical trials? The approval, the conduct of the clinical trials?
The approval
Ini-establish
po
pa
of the
lang?
conduct of clinical trial would be in the purview po of the FDA. Because before conducting a clinical trial, a principal investigator should get an approval from the FDA before they can conduct a clinical trial po.
So I cannot understand why you are saying there might be an overlap. Ay wala pang existing na defined body that is in charge of these clinical trials. So, Honorable Asidre?
Mr. Chair, that's precisely why we're proposing this legislation, so that in the event when such body would have been created, it would no longer be on a project-based or an ad hoc arrangement, but would be grounded on actual legislation, so that both the metes and bounds of what concerns the approval of clinical trials, the application for clinical trials, including ensuring the safety of the patients involved therein, will be provided for via legislation, Mr. Chair.
Thank you, Honorable Asidre. May we now call on the representative from PhilHealth, Dr. Messina.
Good morning po, Mr. Chair, and the other members of this committee po, and also to the rest of my colleagues as resource persons. PhilHealth supports the bill. However, if it is to financially support the clinical trials, it is beyond the mandate of PhilHealth po, as stipulated in Section 6 of the UHC law. What we can support though is on for example, magkaroon po ng hospital confinements of the subjects during the clinical trial or during the conduct of the clinical trial. PhilHealth will be there to support po. But on the funding of the clinical trials, that is beyond po our mandate. Just to reiterate po. Thank you po, Mr. Chair.
Thank you very much, Dr. Messina. May I go back to Ms. Rachel Mendoza? Do you see anything wrong with forming a council with an interagency or multi-agency from the different sectors like Department of Health, Science and Technology, Finance, and of course, the Pharmaceutical and Healthcare Association groups, so that we will have a single body that is accountable and responsible for the approval and in the conduct of the clinical trials, so that we can expedite without compromising, of course, the safety of the patients. Because how long does it take? On the average, how long does it take for an experimental drug before it becomes approved for the actual conduct?
Mr. Chair, it's not that we are parang in support naman po kami with the center. However, yung overlap po siguro na nakikita namin is yung in terms po nung center, pero yung center po kasi na DOST funded po ay maybe institutionalized or be empowered to become the center as defined po in the bill. Pero yung in terms po of function, we agree that there is a need to establish a center.
So my question, sa ngayon, gaano katagal?
From the screening po, yung from the extraction po ng plant hanggang sa clinical trial po, around 15 years po yung natin for the drug discovery and development. From the
No,
start
I mean,
po.
if say an experimental drug from outside
experimental drug
na
po.
kailangan i-conduct ang clinical trial sa Pilipinas, how long does a company have to wait bago ma-approve yung conduct of the clinical trial?
Yung conduct po mismo, I think kung mabilis naman po yung pag-process po nung sa approval po nung application, kaya po siya ng 1 to 2 years or mga 1 year po.
In other countries, how long does it take? Meron bang nakakaalam? Anyone from our resource?
Yeah, Mr.
Yes,
Chair, yeah,
please
this is
identify yourself,
I'm
ma'am.
Jennifer Arellano. I'm from the Philippine Clinical Research Professional. So for foreign discovery and R&D, it takes between 15 to 20 years from discovery to actually bringing the drug close to registration. So that's how the timeline for drug discovery until registration of the drug.
My question is, gaano katagal, say, Company A wants to conduct a clinical trial in the Philippines, Ang problema kasi, ang tagal ng proseso sa Pilipinas bago magawa yung actual clinical trial para magkaroon ng, to find out whether it's really, it's worth approving for general use.
Yes.
So my question is, Ms. Mendoza was saying 2 years. So I was asking, in other countries, our neighboring countries, gaano ba katagal?
Yeah, for the average within the Southeast Asia region takes about between 4 to 7 months, 8 months ang approval process. In the Philippines, right now we're averaging between 5 to 6 months to get all the approvals in place, and as well as start the clinical trial itself.
So it's less than 1 year in the Philippines.
About
Just like
6 to 7 months, sir.
So if I were to believe your statement, then we are not really far behind.
Mr. Chair, if I may give a perspective from the industry and the sponsor, there are countries, Lotus Ramin, sir, PHAP Cares president.
Okay.
In other countries like Taiwan, the approval process to initiate the startup itself is about 2 to 3 months. In Korea, 3 to 4 months. In Australia, about 4 to 5 months. And in the Philippines, it can be as fast as 3 months, but in some other cases, it can extend up to a year. So
In most cases in the Philippines, is it less than a year or about a year?
close to a year, sir.
Okay. Thank you. May we now listen to the position of the Department of Health? Ms. Joanna Malyari Abella.
Good morning, Mr. Chair. So this is to read the position of the Department of Health. The DOH supports the intent of the bill to accelerate the discovery of innovative drugs by strengthening clinical trials. The proposed measure is in fact aligned with the Philippine Medicines Policy for 2022 to 2030. For context, the PMP is the overarching plan that aims to provide key strategies and framework for the improvement of access and delivery of medicines in the country. So identified as one key reform areas or strategies in the PMP to assure the safety, efficacy, and quality of pharmaceuticals is to build and design the clinical trial system to elevate the country as a regional center of excellence where the Department of Health, the Department of Science and Technology, and the Food and Drug Administration are identified as key implementing agencies. There are also other KRAs and strategies in the PMP that are pertinent to clinical trials. So it is apparent that the intent of the proposed bill to make the country a regional center of excellence in the field of clinical trials is aligned with the current directions and priorities of the health system. Nevertheless, this office has just some reservations and clarification on certain provisions of the bill. Specifically, first, on Section 5, the Governing Council. So we suggest to be consistent throughout the provisions on who will be the lead for implementing the proposed bill. So it should be explicitly clarified whether it will be lodged in a certain national government agency or will be established as an independent body. Clarity on the specific government agency responsible for the EDDDC and its council is crucial for identifying the principal agency that will steward and direct resources of the center and its council. Further, if we may strongly recommend adding as qualification for all members the willingness to declare conflict of interest and financial relations in the pharmaceutical industry to make sure that the decisions of the council and the center are balanced, free from external control and undue influence, and that regulatory capture does not occur. On duties On Section 6, duties and functions of the center, we kindly request for clarification as to the extent of the regulatory review and approval of the council, and recommend that this power be limited only to the conduct of clinical trials. On Experimental Drug Development Research Fund, under Section 8, we support the use of this fund, provided that when government funds and/or funds from donations are used in the conduct of clinical trials, such expenses shall not be factored in the price of the innovative drug to ensure affordability and to promote access. On priority review, we likewise support this provision, and we support early access to innovative drugs, especially for those drugs with public health importance, subject to the comments, recommendation, and/or concurrence of the DOST and the FDA. On Section 11, exemption from pricing interventions, while we appreciate the efforts to expedite the discovery and development of innovative medicines, we oppose the provision granting innovative medicines or investigational products exemption from price interventions, as it is in contradiction to Republic Act 9502, also known as the Universally Accessible, Cheaper, and Quality Medicines Act of 2008. It is the policy of the state to protect public health, and when public interest or circumstances of extreme urgency so require, it shall adopt appropriate measures to promote and ensure access to affordable quality drugs and medicines. So in the event that full competition is not effective, the state recognizes as a reserve instrument the regulation of prices of drugs and medicines with clear accountability by the implementing authority as mandated in the law, as one of the means to also promote and ensure access to quality, affordable medicines. Chapter 3, Section 17 of the Cheaper and Quality Medicines Act gives authority to the President of the Philippines, upon recommendation of the Secretary of Health, to impose maximum retail prices over any or all drugs and medicines as enumerated and provided for within the law. The MRP serves as a cornerstone in our efforts to promote affordability. In the determination of MRP, we consider various factors and conditions to arrive at fair maximum prices, fair being prices that are affordable for health systems and patients, while also providing sufficient room for the industry to invest in innovation. The MRP, implemented in a fair and sustainable manner and as a valid exercise of police power of the President, serves the best interests of Filipinos. We echo that this regulatory tool is also aligned with the DOH 8-point action agenda and the national objectives for health, with the objective of ensuring the provision of high-quality, safe, and people-centered services, including access to affordable medicines across the life stages. So while we recognize the importance of fostering innovation in the pharmaceutical industry, we must also prioritize the fundamental right to health and access to medicines. We acknowledge the need for a balance between incentivizing innovation and safeguarding public health interests. Different pricing interventions across the supply chain, including mandatory price caps, are needed to realign drug prices to the universal healthcare agenda and achieve affordable prices for all Filipinos, while ensuring fair and reasonable returns of investments to the industry and ensuring long-term sustainability of the national healthcare system. With this, we strongly urge reconsideration of Section 11 of the proposed bill to ensure that pricing interventions remain within the purview of the DOH, and we advocate for maintaining the reserved instrument of pricing regulation as provided by law, and remain committed to working collaboratively with all stakeholders to achieve our shared goal of ensuring access to affordable, quality medicines. In all other aspects po, we support the purpose and objectives of the proposed center and its council, and we will continue to work collaboratively with all stakeholders concerned to making this possible if passed. Thank you.
Thank you very much, Ms. Malyari Abella. Please submit your position paper to the committee, and this also addressed to all our resource speakers this morning to please submit your position papers to the committee. May we now hear a reaction from the author, Honorable Asidre?
Mr. Chair, I would like to thank the Department of Health for their comments. I will run through the specific provisions that you mentioned, Mr. Chair, that was mentioned. First, on Section 5, the position of the authors is that the Experimental Drug and Development and Discovery Center would be more aligned under the supervision of the Department of Science and Technology, given its role in innovation and research. For the proposal to include qualification regarding the disclosure of conflict of interest, we would want to see the language that DOH is proposing, because understandably we want to make sure that this also becomes a point of engagement with the industry, and inevitably that would include members, a representation from the pharmaceutical industry, Mr. Chair. And in that case, we need to create a more balanced language that would also, I understand the point, you'd want to avoid regulatory capture. I agree with you on that, but definitely there will be 1 or 2 members who would be allied with the pharmaceutical industry, and we'd want to see the precise language that we'd like to suggest. On the Experimental Drug Development Fund, the same, I would want to see the proposed language that, because we are both in agreement with the creation of the fund, but we'd want to see which part of that DOH is not comfortable with. For the exemption and pricing interventions, personally, I'm of the opinion that we should provide this as an incentive to the industry. Government, our capability of funding clinical research is significantly, it's not optimal. And the role of the private sector being the primary driver for innovation in the pharmaceutical industry, for me, it's fair enough that we are able to, I'll say this, incentivize. So, because our goal is to ensure that we're not limiting ourselves to a single or a second investment, but to ensure that we create an ecosystem, Mr. Chair, that enables reinvestments. So if we continue to incentivize our pharmaceutical the players in the pharmaceutical industry, somewhat that would will contribute to the growth of innovation in the country. But nonetheless, I'd want to see if there's any qualifying statement. I understand where you're coming from with the provisions of RA 5 for Cheaper Medicines Act. But probably can find a middle ground. If you could suggest a qualifying provision that would somewhat provide, for example, a standby provision for the President or the Department of Health to suspend the imposition, this provision in case there's a national emergency, or if there's a health crisis that we need to respond to. Maybe that would be the qualification. And I think the period of 10 years is fair enough, because it was even mentioned that, the development period is even 15 years. So just enough, 10% to make it attractive also for the industry, so as to encourage reinvestments in that area. Those are my comments, Mr. Chair.
Thank you, Honorable Asidre. We now listen to the position of the DBM, Ms. Julia Micaela Domingiano.
Good morning, Your Honor. I am Julia Domingiano, Budget and Management Analyst from the Department of Budget and Management. Mr. Chair, we are still in the process po of finalizing our position paper, but we recognize the objectives of the proposed legislative measure to have a dedicated government agency that will handle the regulation of the surrogacy and artificial reproductive technology in the country that aims towards addressing the ethical and other relevant issues and concerns on the said technologies. However, our initial finding on the proposed authority to use income by the Assistive Reproductive Technology and Surrogacy Regulation Commission attached to the
No,
Department of Health.
we are in the clinical trial bill, not yet on the surrogacy.
Apologies, Your Honor. Yes po. That's the one po that we are still in the process po on finalizing on our position paper po, and we will submit once the committee to the committee once the secretary signs the document po. Thank you so much, Your Honor.
Can you state at this point that you are in support of the bill?
Yes po. We are in support of the bill po. However po, on the grant of fiscal incentives, we defer to the position of the Fiscal Incentives Review Board on the assessment of the qualification under the Strategic Investment Priority Plan of all projects and activities that are to be undertaken under this Act po.
Thank you, Ms.
Thank you so
Domingiano. Next is from the Pharmaceutical Healthcare Association of the Philippines, PHAP, Dr. Diana Edralin.
Good morning, Mr. Chair. Good morning to everyone. Honorable Chair and co-author Congressman Ciriaco, Gato Jr., esteemed authors of House Bill number 98678, Honorable Speaker Ferdinand Martin Romualdez, Honorable Yeda Marie Romualdez, and Honorable Jude Asidre, and Honorable Olaso, and Honorable Ricardo Cruz. A pleasant morning to you. Respected members of the House Committee on Health, friends and colleagues from the pharmaceutical and healthcare sector, a warm and pleasant morning to each of you. We, representing the Pharmaceutical and Healthcare Association of the Philippines, or PHAP, extend our heartfelt gratitude to the honorable legislators for inviting us today. Our association, composed of research-based providers of innovative medicines in the country, ardently supports measures that not only recognize but also incentivize the invaluable role of pharmaceutical innovation in improving access to life-saving medicines for Filipino patients. At the start of the pandemic, the research-based pharmaceutical industry had dedicated its best scientists and leveraged on cutting-edge technologies to expedite the development of safe and effective COVID-19 treatments and vaccines. Within the year of the global pandemic declaration, we witnessed breakthroughs in the development of COVID-19 technologies, including diagnostics, with some of the pivotal clinical trials also in partnership with PCHRD, including the WHO Solidarity Trials conducted here in the Philippines. With this, we gained priority access to these technologies, saving the millions of Filipino lives. Clinical trials, as you are aware, are carefully designed by sponsors, undergo rigorous ethical and regulatory reviews, and are conducted by highly trained professionals to ensure the well-being of the study participants. These studies aim to develop new tests, diagnostics, and treatments in the hopes of addressing public health priorities, as mentioned by the Department of Health, and patients with significant unmet needs. By participating in these studies, many patients are given early access to the latest and most innovative products emerging from research pipelines. Clinical trial sponsors pour in significant investments in the conduct of these trials, bringing in high-end laboratory equipment, training and capability building of trialists, development of needed facilities, and establishing support mechanisms for patients, such as free drugs, free diagnostics, and other support, and even helping the institutions themselves. Approximately 3 billion pesos per year are being brought into the Philippines, equivalent to building 28 manufacturing sites or companies. Our country has the needed expertise hospital facilities, and desirable demographics to support clinical trials for various conditions. However, despite these advantages, we acknowledge a concerning decline in our regional standings for clinical trials over the last few years. Challenges specifically in the review timelines, limited infrastructure and support mechanisms, and lack of publicly available disease registries have impacted our clinical trial competitiveness, affecting patient access. The proposed measure before us today holds potential to address this, positioning the Philippines as the center of clinical trials in the region. The bill encompasses vital components from building the necessary infrastructure, facilitating capacity building, securing funding, and providing regulatory and fiscal incentives to offering intellectual property support. Provisions to better support patients are also in place while fostering a collaborative framework, as mentioned earlier, between the public and the private sectors. And if we may, Honorable Chair, we would like to add two more points. First is that in the Council, let's consider, as mentioned earlier, the UP National Institutes of Health and the Philippine Council for Health Research and Development as members of the Council. Second is providing fiscal incentives for investigational drugs as well as equipment, parts, and reagents. Currently, medicines undergoing clinical trials are considered as taxable donation. This results in tax audits, disallowing deductions and deficiencies in tax assessments, adding costs to the research-based pharmaceutical companies. Meanwhile, equipment, parts, and reagents are levied with taxes. We hope that the bill provides clear guidance to tax authorities on this important matter. Once again, we express our gratitude to our legislators for inviting us today. We and our members eagerly anticipate working with you, the committee members, relevant government agencies, and other stakeholders. Together, let us work towards the passage and eventual implementation of this bill. Rest assured, PHAP stands unwaveringly behind you in this crucial endeavor. Salamat po.
Thank you very much, Dr. Edrelin. From the Philippine Clinical Research Professionals Incorporated, we now recognize Ms. Jennifer Arellano.
Good morning, Mr. Chair and members of the committee. So PCRP is, just a brief introduction, Philippine Clinical Research Professional is a nonprofit organization. It's a membership of basically the industry composed of clinical research professionals and from member pharmaceutical companies as well. So we have been in the industry for the past 24 years already and basically conducting and supporting the entry of global clinical trials in the Philippines. In summary, Mr. Chair, PCRP agrees that there's a need to enact this legislation to streamline the processes that the clinical trial is undergoing, basically supporting also the need for ease of doing business related to clinical research processes. So this legislation can help us address issues that are barriers to allowing us easier participation, conduct, and investment in the Philippines by patients, researchers, sponsors, R&D organizations through the development of a national clinical research development program and a national clinical research center. So suggestions that we have include involving different government agencies, as you see that the clinical trial will have to go through several government institutions in order to gain the approval for the conduct of the clinical trial. And currently, part of the challenge that the industry is facing is that some of the government agencies are not very familiar with the requirements for clinical trial. So to ensure the ease of doing business, doing clinical trials in the Philippines through effective and ensuring the cross-agency policy and arrangement at the national, local, and institutional level, regulating the licensing, approvals of permits and importation and exportation and data sharing. So PCRP also supports the central body to ensure the strategic alignment with the national plans and programs to strengthen the clinical trials with a view of improving access to the innovative medicines and investigational products. So the center needs to address, if we may share, to address the following burdens of the conducting clinical trials in the Philippines. Part of that has been earlier alluded already, is the inconsistent timeline of startup in the Philippines and the maintenance of a clinical trial, requiring various licenses, approvals, permits at national, local, and institutional level. Also, increasing the increasing clinical trial cost in the Philippines, now seen as higher than our regional peers, is something that we need to also focus on in order to sustain our competitiveness in the region. The lack of business incentives for sponsors and R&D organization to support local conduct of clinical trial or set up global clinical trial outsourcing operations. The limited number of institutions, ethics committees, investigators to conduct and approve our clinical trials. There's also a need to focus on capacitating the R&D workforce supporting the clinical trial. And there's also a need to an attention needed on the large patient pool that does not translate to competitive or high patient recruitment for the Philippines. Thank you.
Thank you very
Your
much,
Honor.
ma'am. Our last resource person is from the Philippine Chamber of Pharmaceutical Industry Incorporated, or the PCPI. We now recognize Ms. Jhin Garcia Diola.
Magandang umaga po, Honorable Chair, to our respected legislators and our respected colleagues also in the industry. From the Philippine Chamber of Pharmaceutical Industry, sir, we would like to fully support the House Bill 9867. However, we would also like to get some clarifications on its alignment with the current Philippine Innovation Act, or the RA 11293, signed on April 17, 2019, as well as the alignment of the provisions or the goals and strategies being actively discussed with the different interagencies as well, like the Bureau of Investments, the Department of Health, Food and Drug Administration, on the creation of the Philippine Pharmaceutical Roadmap. So basically, what we can see initially is, of course, we have the advantages of the House Bill, which encourage advancement in healthcare, economic growth, access, of course, to new medicines, the encouragement of the research and development ecosystem in Philippines compared to its ASEAN counterparts, and of course, the interagency collaboration and coordination. However, we also see several challenges, especially on the intellectual property, the cost of innovation, market monopoly, ethical considerations, and of course, the implementation challenges. And based on this premise, we would also like to make a manifestation, since we were only advised on this House Bill and the inclusion of PCPI just a day, I think just last Monday. So we would like to make a manifestation that in the creation of the Council, PCPI would like to be actively involved, as well as perhaps this is still early stages, but we would like to highlight the recognition of herbal medicines, as innovative medicines as well, and not just food supplements with evidence-based data. And of course, relaxing or a sound policy on tech transfer for local manufacturers. So based on this premise, Honorable Chair, perhaps we would still need some more time also to make a specific position on PCPI's position for this House Bill resolution. Thank you very much.
Thank you very much, Ms. Diola. Honorable Asidre?
I think she mentioned that you want to submit recommendations, no? We just want to see, Mr. Chair, the recommendations.
So we please submit your position paper so that we can see the specifics of your recommendation, Ms. Ajola.
Thank you very much, Honorable Chair.
Mr. Chair,
Yes.
with regards to the inclusion of herbal medicines, no, I think I agree with the chair that in certain cases we're looking at their efficacy in terms of as medicines, they may be admitted, provided that the clear distinction and demarcation with the roles of PHAP would be specified, probably in the IRR or.
Thank you, Honorable Asidre. Any other comments from the members of the committee? Honorable Cruz.
Mr. Chairman, I move for the approval of House Bill 9867 subject to style.
I second.
So there's a motion by Honorable Cruz, duly seconded by Honorable Olaso, that House Bill number 9867 be approved subject to the amendments and style. Hearing no objection, House Bill number 9867 is hereby approved.
Mr. Chairman, may,
Yes, Honorable
may we request also to be included as co-sponsor?
With, second,
Yeah, I second.
with the permission of my co-authors, there's a motion that all those members present who wishes to be co-authors be made as such. Hearing no objection, the same is approved. Congratulations, Kong Asidre.
Mr. Chair, on behalf of the authors, would like to thank the committee for the approval of the said measure.
Thank you very much. May we have a 1-minute break? And then we will now proceed with the next bill on ART. Meeting is resumed. For the resource persons on the clinical trials, you're free to leave. If you want to attend, it's okay. So now we proceed with the next bill, House Bill number 8301, an act entitled An Act Providing for the Framework for the Conduct and Regulation of Assisted Reproductive Technology and Surrogacy Procedures and Appropriating Funds Therefor, by Honorable Khymer Adan Olaso. Honorable Olaso, you are now recognized.
Thank you, Mr. Chair. Good morning, ladies and gentlemen. To our Speaker, Martin Romualdez, and of course, to the honorable members present, Congressman Ricardo Cruz, good morning. Esteemed colleagues and resource person, muy buenos días con ustedes todo. It is an honor to be here with you today as I join you today to advocate the immediate passage of House Bill number 8301 that seeks to regulate the assisted reproductive technology, ART, and surrogacy in the Philippines. This legislation is not only imperative but also long overdue, as it addresses a pressing need to safeguard the rights and well-being of all parties involved, particularly the children born through these procedures. Infertility is a pervasive issue affecting countries, Filipino couples, with statistics revealing that approximately 1 in 10 couples experience difficulty conceiving. Moreover, studies conducted by reputable institutions such as the University of the Philippines, Population Institute, and St. Luke's Medical Center underscore the prevalence and infertility with significant percentages of women and couples grappling with this challenge. In response to this growing demand, ART and surrogacy have emerged as viable options for individuals and couples yearning for parenthood. However, despite the potential life-changing benefits, there have been distressing incidents stemming from the unregulated practices in our country, instances of surrogate mothers and being burdened with exorbitant medical bills, exploitation by surrogacy, brokers, and the abandonment of mistreatment of children born through this procedure have tarnished the reputation of ART and surrogacy. Furthermore, ethical issues loom large over these practices, prompting concerns on whether ART and surrogacy commodify women's bodies and raise ethical dilemmas regarding the creation of children solely to fulfill the desires of intended parents. To address these multifaceted concerns, the bill proposed the establishment of regulatory body tasked overseeing the practice of ART and surrogacy. The body will ensure that all stakeholders are fully informed of their rights and responsibilities, and the safeguards are in the place to protect the interests of everyone involved, especially the children born through these procedures. Additionally, the bill mandates the registration of all ART surrogacy procedures with regulatory body, thereby facilitating accurate data collection and monitoring of outcomes. Crucially, the bill addresses the issue of percentage by stipulating the children born to surrogacy shall be recognized as biological offspring of the intending couple, entitled to all rights and privileges afforded by natural children undergoing existing laws. The provision underscores that the paramount importance of prioritizing the best interests of the child in all matters related to the ART surrogacy. In essence, the enactment and assisted reproductive technology and surrogacy regulations, law is not just legal imperative but a moral obligations. By enacting these legislations, we affirm our commitment to upholding the productive rights of all individuals while safeguarding the dignity and welfare of every child born to this procedure. I respectfully ask each and every one of you to lend your unwavering support to this bill. Let us seize this opportunity to welcome a new era of ethical and safe implementation of ART and surrogacy in the Philippines. The time for actions is now, and the passage of this bill is not just desired but essential. Thank you very much, y muy buenos días ka natin todo.
Thank you very much, Honorable Olaso. We now listen to the position of the first from the Department of Health, Dr. Mary Rose Argente.
Good morning, Mr. Chairman. Good morning to the honorable members of the committee and to all those present here today. So the Department of Health does the intent to provide for an act which shall provide for the regulation of assisted reproductive technology and surrogacy in the Philippines. The DOH respectfully elevates to this body the complex social, ethical, moral, and legal issues associated with surrogacy. So before establishing the Assistive Reproductive Technology and Surrogacy Regulation Commission, the following should be considered. First, the full implications of undergoing IVF and surrogacy procedures, the medical risk associated with pregnancy, the practical difficulty and the cost of the treatment, the social implications associated with surrogacy, the chances of having multi-fetal gestations associated with assisted reproductive techniques, the exploitation of poor surrogate mothers, and the importance of obtaining legal advice and the legal complexities associated with surrogacy. Furthermore, the department recommends that the commission should be in charge of the formulation of the policy, but not the issuances of the licenses and the permits, and that the commission identify which agency will carry out such role. Lastly, the DOH will submit its official position statement once signed by the Secretary of Health. Thank you, Mr. Chair.
Thank you, Dr. Argente. So with all the considerations that you mentioned, can you say at this point whether you are for the bill or you are not for the bill?
We are for the bill for the assisted reproductive technology, but we have reservations for the surrogacy.
Thank you, Dr. Argente. Next, from the Department of Budget and Management, Ms. Dumingiano.
Good morning again, Your Honor. As I've said earlier po, our initial finding on the proposed authority to use income by the Assistive Reproductive Technology and Surrogacy Regulation Commission attached to the Department of Health may be inconsistent with our one-fund policy. Under the said fiscal management policy, as much as possible po, all revenues and other receipts of the government must enter the general fund and their utilization and disbursement subject to the budgeting process. The DBM would also like to emphasize the comments of the economic managers dated August 22, 2023, submitted on both houses that as a general rule po, we discourage the earmarking of funds for specific items of expenditure in as much as it limits the flexibility of the government to efficiently allocate public resources. Nonetheless po, Mr. Chair, the DBM defers to the wisdom of the honorable committees on the matter po. Thank you so much, Your Honor.
Thank you, Ms. Domingiano. From PhilHealth, Dr. Messina.
Good morning again, Honorable Chair and the distinguished members of this committee. For PhilHealth, we have no objections on the proposed House Bill 8301. We would like to reiterate that we already have benefits packages for maternal health care, with the health services ranging from antenatal care, delivery, up to the postpartum care. We also have a separate benefits package for the newborn care. This benefits package can be availed of by all Filipino women and newborn, regardless if the mother is a surrogate one. Okay. We have, however, take note on the premium contributions of the mother if the proposed measure will be passed into law. But on the development of a new benefit package in support of the ART, the protocol is always the standards from the DOH, recommendation from the health technology assessment, and of course, the funding of PhilHealth, if it will be recommended by our actuary. That is all po. Thank you po, Honorable Chair.
Thank you, Dr. Messina. So you're saying that yung mga surrogate mothers while during pregnancy or during delivery covered ng PhilHealth? Surrogate
Yes
and
po,
those
because
couples?
Unknowingly, we do not investigate naman po.
So
Yes,
it doesn't
we just
matter
cover,
whether
yes.
it's through ART
Yes.
or not.
Yes
Covered
po.
automatic.
Covered po automatically.
Okay. Thank you,
Thank
Dr.
you po.
Messina. From the Commission on Human Rights, Ms. Patricia Isabella C.
Good morning, Mr. Chair. The Commission on Human Rights supports the regulation of ART and surrogacy to ensure the protection from abuse and exploitation of the parties involved, subject to some comments and clarifications. In Section 8, it is recommended for the ART and Surrogacy Regulation Commission and DOH to be mandated to conduct anti-stigma campaigns in relation to this topic. In Section 9C, in addition to providing counseling and support in decision-making to the commissioning or intending couple, the same services should be provided to the surrogate. Still in Section 9, aside from acquiring informed consent, the ART and surrogacy clinics and banks should also have the obligation of ensuring that the intending couple and the surrogate are aware of their responsibilities to the other party. In Section 10.2D, the Commission recommends specifying the amount of the medical insurance coverage, clarifying who will be prescribing said amount, and including prenatal necessities in the medical insurance coverage. The Commission also recommends providing mental health services for the surrogate to ensure they receive holistic postpartum care. To ensure the welfare of the child, we also recommend for the FWD to conduct regular visits to the child for a set period of time. And Mr. Chair, we would like to request clarification on whether foreign intending parents would be allowed to seek a Filipino surrogate. And should this be allowed, we would like to recommend the legislators to ensure that children born from surrogacy may be protected from statelessness. And equally important is how will the ART and Surrogacy Commission and the FWD ensure the rights of the child are protected. Lastly, Mr. Chair, we would also like to seek clarification as to the rationale behind limiting the eligibility of surrogate mothers to those who are ever married and with a child, and to those who have not yet successfully completed the surrogacy procedure, and the limitations on who can be a commissioning or intending couple, which I believe the bill limits it to married couples. That's all, Mr. Chair.
So, pending the clarification of your concerns, you are in support of the bill. Thank you, Ms. C. We now call on the from the Philippine Council for Health Research and Development, Dr. Aman.
Thank you, Honorable Chair, for giving space to the DOSTPC-HRD for these talks. We recognize the importance of HB 8301 and is in support to this legislation because regulating assisted reproductive technology and surrogacy in the Philippines is essential for promoting ethical practices, promoting the rights of individuals involved, ensuring legal clarity, and addressing the unique cultural and social considerations of the country. Well-crafted regulations contribute to a responsible and safe environment for the practice of assisted reproductive technology, benefiting both healthcare professionals and those seeking reproductive assistance. I would like to provide some of the comments that we made to the bill. So in Section 2, Declaration of Principles, specifically on human rights, please ensure the explicit mention of surrogate mothers, as this bill explicitly includes this option, and as evidenced by cases in other countries wherein surrogate mothers are disproportionately affected by stigma and violation of human rights. We also suggest to review the clause on the unborn. If the unborn clause is kept in the second paragraph of Section 2, we probably should include the definition of unborn and conception, as well as the definition of an unborn child. We suggest this because some of the procedures done in ART may be limiting and may involve fertilizing more than one egg. For Section 4, given the powers and functions of the Commission, we think that the 3 people may not be enough to comprise the Commission to support the system and the processes. So we suggest revisiting and reorganizing the structure, probably including an organogram and other crucial staff needed for the efficient functioning of the body. And we also suggest to have an advisory board to the Commission composed of representatives from the CHR, DOH, DSWD, PMA, and an advocacy group. We also suggest to create a provision in the law that there must be an ethics oversight committee for proper monitoring of the facilities and other concerning circumstances, as well as to review cases as needed and to advise the Commission. The official position statement of the department will be submitted to the committee once signed by the Secretary.
Thank you very much, Dr. Aman. We'd like to acknowledge the presence of our Honorable Jane Castro of the 2nd District of Capiz. Thank you very much.
Good morning, everyone.
We now recognize from the Philippine Medical Association, Dr. Prudencio Santa Lucia Jr.
Magandang umaga po, Mr. Chair, and sa lahat po ng mga members ng committee ito. For now po, the Philippine Medical Association is still on the process of asking the members, especially those who are in the different religious groups. And we are still on the process also of trying to compare the bill with our ethical standard. And so upon after we have already decided on what will be our stand on this, then we will submit it to your committee, Mr. Chair.
Thank you, Dr. Santa Lucia. So at this point, wala pa kang position ang Philippine Medical Association.
Opo, because we are trying to be...
So you're still on the consultative stage.
Opo, sir.
So may we know how long will it take for you to come up with a stand or a position on this very important bill?
Maybe within 2 weeks po, because March is the first week of March is the national election of the Philippine Medical Association. So probably within 2 weeks we are going to convene, and also the members of the Commission on Ethics will have to see the bill. How do we give our suggestions on this within 2 weeks po.
Thank you very much, Dr. Santa Lucia.
Salamat po.
Next is from the Philippine Society of Reproductive Medicine, Incorporated. We now listen to Dr. Debbie Packing Sonko.
Good morning, everyone. I'm Dr. Debbie Sonko and the President of the Philippine Society for Reproductive Medicine. This society is composed of experts in the practice of assisted reproductive technologies. We were informed of this bill at the latter part of 2023. Hence, a task force was made and is now headed by our past president, Dr. Virgilio Navarro. With me is the past president, Dr. Ramirica Torres, and a board member, Dr. Dada Ranyola. Dr. Virgilio Navarro, who will be presenting our position statements as a society pertaining to House Bill 8301. Dr. Navarro.
Thank you. Dr. Navarro, you may now proceed.
Thank you, Your Honor. Honorable Congressman Gato, Honorable Congressman Cruz, Honorable Congressman Olaso, and Honorable Congressman Castro, and friends, colleagues, and ladies and gentlemen. I've been told that we have limited time. I thought we would need to give everything that we prepared for everyone's knowledge about ART and surrogacy, but I was told we don't have time. So I'll try to condense what we have prepared and just pick on the relevant features of what we prepared. Background on the global ART practice. In July 1978, infertility treatment was changed forever with the birth of Louise Brown, the first test tube baby. Since then, ART has evolved and helped millions of infertile patients, with now over 12 million babies born after IVF in 2023. Most reports estimate that ART babies in Europe constitute about 1 to 3% of all babies born. In the US, about 2.3%. About 2.5 million IVF cycles are performed worldwide every year, and an annual market growth of about 9.1%. However, the access and utilization of ART services vary tremendously around the globe. Many factors have been identified, including cost, availability of experts and facilities, per capita income, cultural and religious beliefs, awareness, among others. The European Commission estimated that 3,000 cycles per million population per year will meet the demand in a population group. And in a report by Pipert in 2023, only a few countries have reached this, including Israel, Japan, Denmark, etc. In Asia, where it was reported that China, Taiwan, India, Vietnam, Malaysia, the Philippines, and Indonesia fall well below this threshold, but we have fast-growing industries here, and the updated IVF utilization in the Philippines last year is 52 IVF cycles per million Filipinos per year. The indications for IVF ART have evolved from tubal factor infertility in 1978 to various reasons, including but not limited to anatomic, hormonal, male, genetic, immunologic factors, including donor and surrogacy. Couples use autologous gametes, accounting for 85% of ART cycles. IVF cycles using donated gametes account for 11%, while surrogacy cycles comprise only 4% of all cycles based on US CDC data. The indications for donor and surrogacy cycles are also distinctly different from standard ART cycles using autologous gametes, and this accounts for much of the controversy for these indications, especially when commercialism and religion are considered. Although surrogacy offers a possible solution for an infertility problem, it carries with it complex social, ethical, moral, and legal issues that make it an extremely controversial topic in reproductive medicine. General issues of commercialism, exploitation and abuse, safety, security, and morality are often included in the complexities of discussions, including altruistic surrogacy. Specific issues like allowable costs and fees, indications for surrogacy, consent of the surrogate's husband, reimbursement of reasonable personal expenses, coverage of unexpected obstetric complications, chance for abnormal children, and many more are the culprits for conflict. Most countries have avoided its practice, either local, international, or both, specifically to avoid such complexities. The celebrated incident of an Australian couple who sought surrogacy services in Thailand in 2014 is a favorite discussion topic among those who warn about the horrors of surrogacy. In that arrangement, which resulted in a twin pregnancy of a normal baby and a Down syndrome baby, the intended parents brought back to Australia only the normal baby, leaving the surrogate mother to fend for the abnormal child. It brought into focus how an economically challenged mother in a developing country may be exploited and abused by rich intended parents from a foreign country. It also showed the inadequacies of international law that were unable to protect all parties, including baby, surrogate, and the intended parents, in the arrangement. That single international incident resulted in the banning of international surrogacy in Thailand and India from then on, despite hugely thriving industries in both countries. Today, commercial and altruistic surrogacy and their variants are practiced in several countries around the world, including in the US, where variations in their legalities vary in different states. Overall, regulation in the different countries are fluid, periodically changing with adjustments made as new problems emerge. ART practice in the Philippines. In the Philippines, the practice of IVF started in 1996 under the shadow of the Catholic influence. Progress was very slow and was hampered by suboptimal results and inadequate public awareness. With the new opening of new IVF centers and improved technology and expertise, by year 2020, we already are doing 5,930 ART cycles per year from 8 accredited local IVF centers scattered around the Philippines based on the latest PSRM statistics, with an annual growth rate of 10 to 20% achieved by most IVF centers. We estimate that about 7,500 babies have been born after IVF cycles in the Philippines from the outset, and currently over 1,100 Philippine-made IVF babies are born every year. That's 1,100. The first guidelines in ART in the country were formulated by consensus in 2006 by the PSRM, Committee on Formulation of Ethics and Practice Guidelines, in ART, chaired by myself, Dr. Novero. There were 16 statements formulated about the basics of ART practice, including the moral status of the embryo, ethics of ART, patients who may be accepted for ART, and restrictions against third-party IVF that included donated gametes and surrogacy. This restriction was generally imposed again because of the by consensus because of the Catholic influence. From then on, another 2 editions of the ethics guidelines of PSRM were made, 2011 and 2016, and a 4th one was recently done in 2021 to 2022. And all of these included the statement that surrogacy and donated embryos are not to be accepted, are unethical, and could not be practiced in the Philippines. The estimated number of surrogate couples in the Philippines, medically indicated, amounts to about 50 per year, which is about 0.8% of all ART cycles in the country. So these are our position statements. The PSRM recognizes that there are a specific number of Filipino couples who require surrogacy as a means to alleviate their infertility problem, and that the country has the technology and expertise to help these couples. However, the procedure is considered unethical based on the society's past 4 editions of its guidelines during the past 18 years. So the PSRM cannot endorse the medical practice of surrogacy for its ethical and moral implications at the present time. Number 2, although the proposed bill is entitled ART and Surrogacy Act of 2023, much of the provisions really appear to focus on surrogacy and not ART. As previously mentioned, Based on the US CDC statistics, surrogacy comprises only 2 to 4% of the total ART cycles, whereas ART for couples using autologous gametes comprise about 85%. And in the Philippines, the current statistics are nearly 100% for autologous couples because of restrictions from the guidelines. The PSRM believes that we must address the needs of ART for couples using autologous gametes first, ahead of couples who require third-party ART. Our proposal, therefore, is to pass a separate ART bill as a priority and take up third-party IVF, which includes both donor IVF and surrogacy, at a later time. This is because of the following reasons. The surrogacy bill would only benefit 2 to 4% of the total ART cycles compared to 85% of ART couples who utilize autologous gametes. B, the discussion points on surrogacy are far more difficult than in ART. These are highly controversial, contentious, and polarizing that may affect the passage of the less contentious issues in ART for autologous couples. In Australia and India, where surrogacy bill was initially proposed, there was an eventual shift to the discussion to more basic ART provisions. Furthermore, we envision the ART bill to form an ART regulatory commission composed of an ART specialist with an ethicist and lawyers, plus restrictions against foreign medical practitioners and foreign patients, and completely trained local physicians according to the PSRM competency levels and the practice of ART. Number 4, the PSRM, however, welcomes the attention given to infertility indirectly and ART directly with its potential legislation. This is in part to relieve the PSRM of its current role of regulating ART practice in the country. Number 5, the PSRM believes the legislation of services is a form of official recognition of ART as a legitimate industry in the country and will help strengthen existing policy and encourage future ART centers to protect their services. And furthermore, in a 2023 WHO report, providing infertility treatment is an important component of sexual and reproductive health rights and is central to achieving Sustainable Developmental Goals 3 and 5, healthy lives, well-being, and gender equality and empowering women. Over 50% of infertile couples will require ART at some point in their lives. Number 7, although there are population experts that claim otherwise, there is a progressive decline in the fertility rate of Filipinos, according to the latest Philippine Statistics Authority, from 2.3 in 2017 to 1.9 in 2022, which is for the first time below the replacement level fertility. Replacement level fertility is the level of fertility at which a population exactly replaces itself one generation to the next, and 2.1 children per woman is regarded as the replacement level. It is worse in urban areas in the Philippines, 1.7, compared to rural areas, 2.2. So addressing infertility via ART is a way of addressing this declining fertility in the Philippines. Number 8, with the recognition and legislation of ART services to address a growing national problem, it will hopefully pave the way for some amount of government subsidy because of the projected increase in basic needs for ART services. And legislation will help curb unscrupulous ART practice in the Philippines, which seems to have begun in recent years. One such laboratory parades itself as an online company recruiting patients by internet advertisement and engage patients online through non-medical personnel and offer experimental IVF-related procedures. When pursued by representatives of PSRM, they play hide and seek. They appear to be foreign-owned and engaged in the services of unregistered foreign professionals. With the growth of the IVF industry in the country, we can expect the proliferation of such shady, illegal practice in the Philippines. I think that's it. Thank you very much.
Thank you, Dr. Novero. Before we proceed, we'd like to acknowledge the presence of one of our Vice Chair, Honorable Larny Levin Roque of the 4th District of Bukidnon, and also one of our Vice Chair and Chair of the Committee on Civil Service and Professional Regulations, Honorable Christine Alexi Tutor of the 3rd District of Bohol. Thank you very much for your presence. We now call on... Okay. So, anyone from the members or the author? Honorable Olaso.
Mr. Chair, I would just like to ask a question to PSRM, PMA. In Florida Blanca, Pampanga, there is a center that operates and conducts surrogacy procedures without the necessary law to regulate surrogacy. How will we be able to do exact accountability to the surrogacy centers operating in the country? Should there be any untoward events that could happen soon for these surrogate mothers, or you know, their protections, whatever that can save the mother, you know, like what we have discussed a while ago in Thailand, pertaining to surrogacy, the where's that the Australian couples did a surrogacy in Thailand, and they got two children. Then the good one they have taken back to Australia, but the bad one, they have, with Down syndrome, they have left it in Thailand. But in our country, we won't allow it, as we only do this basically for the Filipino parents, that, you know, lahat ng problema ngayon, kahit anong ginagawa natin, mayaman tayo sa mundo, ang problema wala tayong anak, nagkakahiwalayan pa rin yung mga magulang. So this is my main point of view of this bill. Now, going back to Florida, Pampanga, I would just like to know kung aware ba kayo na may ino-operate na ganitong center sa ating bansa.
Anyone from PSRM?
We don't have an IVF center in Florida Blanca. I think it is, you might be referring to IVF centers in Angeles, Pampanga. There are 2 IVF centers there. But none in Florida Blanca. So if it's really in Florida Blanca, it's really under the radar. We are not aware of that.
Yeah, it's an HOS, Florida, Pampanga. Kindly check on Facebook kasi lumalabas sa Facebook eh. At least pwede nyong i-verify po. Kasi kailangan natin i-regulate. Kung meron naman nag-operate ng ganito sa ating bansa, why not regulate such, di ba? Eh, gumagawa na pala sa ating bansa. And you know, a lot of Filipino parents, they're going, to the extent, going abroad, doing such, di ba? Para magkaroon lang ng, sariling anak. Why we cannot do this in our country? Anyway,
Sir, can I respond to your question?
Dr. Torres?
Yes. During my presidency, which was last year, as Dr. Navarro has mentioned, there is a foreign company that actually recruits patients for these ART services, and they flagrantly advertise surrogacy as one of the services that they offer. And as a matter of fact, we have done our preliminary investigations for such procedure, and I don't know if I can get a privileged communication, because actually we have a personnel from that company who actually approached us. But our initial efforts during the initial time that this issue has surfaced, we actually asked the help of a government agency to investigate motu proprio on the ongoings of this foreign company. And we actually talked with the foreigner who was involved in that operation. So, but unfortunately, we were faced with a blank wall because there were certain requirements that we cannot comply with as a non-profit organization. But I can inform the body of the details of that communication, and maybe you can help this person who approached us, because they have, I think she has a lot of prima facie evidence which will actually pin down this foreign national and their operations.
Mr. Chair?
Yes, sir.
Okay, pertaining to that prima facie evidence, nandyan na pala yan eh, di ba? So kaya nga, ginagawa natin, sinusulong natin itong batas na to dahil nangyayari na to sa ating bansa. And if we will not allow this thing to happen in our country, wala tayong batas, ito, that will continuously happen. And aside from that, we have a neighbor in our city that they got also an offer na ganito rin ang in-offer sa kanila. And this is very rampant in our country, Mr. Chair. Kaya nga hinihiling natin to na isumitin natin itong batas na to, isulong natin to, sinusulong natin para maaprubahan to, para maging legal to sa ating bansa. Whether we like it or not, it is already happening in our country. The only thing is that we have to open our hearts and open our mind for this thing na nangyayari sa atin. We cannot afford na mangyayari to. Hayaan pa ba natin tulad nangyayari sa Thailand or other parts of the world na iniiwanan yung mga anak? Kawawa naman yung mga yung mga parents na kumakarga ng bata 9 months in their home tapos papabayaan lang ng mga magulang because there's no law that is stating and stipulating to protect the welfare of the parents. Yun lang, Mr. Chair. Salamat po.
Thank you, Honorable Olaso. Yes, Dr. Songko.
Thank you, Congressman Olaso, for that, for those comments. No? So taking your notes into consideration, then probably the best bill that should be proposed, it should be against surrogacy and just a law protecting ART, not surrogacy itself. Because it's two different things. When we talk about ART, we talk of married couples going into an ART program, but when we talk of surrogacy, we implore third-party IVF. So if we would want to protect these women, because the woman becomes a commodity, then we need to have a bill against surrogacy and a law that will protect our women. So if it's a law that will regulate surrogacy, it will not actually tell us that it can protect our women. So it should be a law that will hinder, would that be the best word, or not allow surrogacy in the country.
Mr.
Yes,
Chair,
Honorable Lasso.
I fully understand about the query of Ms. Dr. Debbie Songko. But unfortunately, there are parents that they could no longer bear child. Na gusto nilang magkaanak pa. Why not give them the chance to bear a child na magkaroon ng anak, children to surrogacy, di ba? Akala ko ba gusto natin na masayang mga magulang. Unfortunately, in my city itself, there are parents who still wants to have children but hindi na kaya because of their old age. But because they are very wealthy enough, they were able to preserve some eggs in the bank. Now they still want to have those. Hindi na pwede dahil wala po tayong batas na nag-aalaw niyan. That is why we're asking everyone to be considerate with this matter. We're not just talking about the young parents, but we're also talking yung mga may edad na rin na gusto pa talaga mag-anak. I believe maraming mga doktor gusto rin ng ganun, kaso nahihirapan. To the extent, they go abroad para lang magkaroon yan. And going abroad, mahirap in situations. They have to stay there for a couple of months and uwi naman dito. Then yung expenses, it's quite expensive also na magkakaroon ng ganun. Mas maganda na pag yung nagdadala is Pilipino, at least nandito lang tayo sa ating bansa. We can make sure hindi tatakbo yung bata. Nandito yung bata sa atin. May protection po for both sides, parents and children. That's all, Mr. Chair. Thank you.
Thank you, Honorable Olaso. You want to respond? Yes, Dr. Novero.
Thank you, Mr. Chair. Just to respond again, I would like to emphasize that the position of the PSRM is not immediately to ban surrogacy, but because it is unethical right now, it seems to be not the right time that it should be implemented in the Philippines, but rather The one where we should focus is ART, which covers ART for autologous couples who wish to use their autologous gametes, which is 85% of the total ART cycles. Surrogacy only accounts for about 2%. We understand that there are couples who need surrogacy. We meet them. We know there are about 50 of them in a year, and we advise them cross-border care. They go abroad. We are very much aware of that. But even the 85% of the 6,000 cycles that we do have also their own problems. And these include problems, and there are issues that we need to resolve about preconception, pre-selection, the ethics of ART, which patients are accepted for general ART, cryopreservation, pre-implantation genetic testing, guidelines for ART clinics and practitioners, number of embryos to be transferred, etc., etc. There's so many things to take up in ART, and I think this deserves a bigger focus first before taking on the 2% of the surrogacy.
Thank you.
Yeah, Mr. Chair.
Yes,
I fully understand about it, but yun ano lang naman natin is the protection and rights of the children who is born under surrogacy. Dapat protektado po sila. Nangyayari na sa ating bansa. Yun lang po kung hindi nangyari sa ating bansa yan, wala naman problema That the point there is nangyari na, inahintuan ba yan? Wala. And it's still continuously existing in our country. Lumalaki po yung populasyon ng gumagawa ng mga yan. And we need to protect these children. We need to protect the parents on both sides. Kaya nga, hindi natin ikinasasama yung magkaroon ng surrogacy sa ating bansa. Let's open our hearts. Kawawa naman po yung mga bata na isisilang na walang proteksyon. Kawawa rin yung mga magulang kung makarga ng mga anak, ng mga bata na walang proteksyon sa kanila. That's all, Mr. Chair. Thank you.
Mr. Chair.
Thank you.
Mr. Chair.
Yes, Honorable Cruz.
Mukhang with regards to House Bill number 8301, mukhang marami pang dapat ayusin Kaya I suggest na mag-create muna tayo ng TWG o Technical Working Group para maplansya ng husto itong bill na to.
Before we will act on that motion,
May tatanong pa ba? Okay.
maybe also, are there other members who would like to?
Mr. Chair,
Yes,
I'd
Honorable
like
Roque.
to make a clarification lang siguro kasi we've been talking about this bill and it's actually about the ART and surrogacy. Some of our resource persons were actually suggesting to ban surrogacy and only apply with ART na hindi naman yan yung bill. Ang bill natin is to regulate both ART and surrogacy. So that's what we're trying to inform our resource persons kasi katulad nga ng sinabi ni Representative Olaso, nangyayari na siya. Since nangyayari na siya, what we need is to regulate it para walang mga hindi magandang mangyayari both sa parents or sa magiging surrogate. Imagine mo marami naman, it's a given fact. Some of our Filipinos go abroad, have it there. Na pwede naman natin gawin dito yan. Sa totoo lang, yung mga surrogate parents, yung mga mothers, they are well compensated. Tsaka ginusto nila yon. Kasi magaling silang mag-anak. Meron silang history na nakakaanak sila ng healthily. Tsaka, kailangan din nilang, siguro, nangangailangan din yung surrogate mom. And inaalagaan din sila. Pati medications nila, lahat, hospitalization, lahat ng kailangan ng surrogate parent, ng mom. Pino-provide yan sa kanilang lahat. Kaya nga, tinanong ko kanina kay Comsec kung meron bang tayong invited na taga-DOJ para pati yun, maprotektahan din natin sila. So because we are talking about a bill for both ART and surrogacy, we are not even thinking about banning one from one because we're considering both. So all at the same time, I'd like to manifest my support for this bill, Mr. Chair. Thank you.
Thank you, Honorable Roque. Honorable Chitor.
To our DOH po, just anyone na lang po. This bill, it consists of dalawa kasi to ART and surrogacy. So, both are not really the same. Kasi yung surrogacy is there is a third party, di ba? So, which one do you think mas doable natin? Because when we say surrogacy, we are not just only protecting the child, but we have also to look on the rights of the woman itself. Hindi naman pwede tutukan lang natin yung bata, tapos yung the surrogate mother, yung rights niya hindi naman natin makikita. We have to see both of it. So, yung gusto ko lang na makita is which one? Should we consider both for the ART and the surrogacy, or we have to focus first on one, the ART, then ibahin natin yung surrogacy? Kasi they are both totally different and the rights of both iba din. Diba? So, yun yung nakikita ko dito. So, Mr. Chair, yung nakita ko dito po is, it's better if we'll move for a TWG and we'll work on it, whether we are going to push for both procedures or we have to focus one over the other, which one is more doable. Just my point of view lang po, Mr. Chair.
Thank you, Honorable Tutor. I'd like to... Meron pa ba? May I now ask some clarification? Number one, of course, I think we are all in agreement that we are trying to find a solution for those couples, mag-asawa, or couples. I don't know if you consider them as married or unmarried, who wishes to have a child. Nagkakaisa tayo doon. Kasi sa totoo lang, yun naman ang the heart of this bill is to find a solution sa mga partners, couples na gustong magkaroon ng anak na hindi successful through the natural means of pregnancy. Now, may I ask, in assisted reproductive technology, the PRM has an ethical body. But PRM is a private organization. So may I ask the Department of Health, do we have a government agency that regulates ART?
None from the Department of Health. There's no agency pertaining to ART ethics po.
Yes, so there is none. We are dependent on a private organization made up of experts. We recognize the expertise of the members of the Philippine Society of Reproductive Medicine. Number two, you said, there are two solutions of these couples who wishes to have a child. One is the ART, and in your definition from the PSRM, this applies only to married couples. Am I correct?
That is one of the, Mr. Chair, that is one of the intricacies of the ART bill that probably needs to be settled. In the Philippines, by ethical guidelines, we propose to treat only married couples.
Yes.
But the number of couples who are not married but have stable relationships and have so many reasons why they cannot get married far outweighs the number of those who who require surrogacy.
Yes.
So that's why we were thinking by numbers itself.
Yes, we understand that. In other words, mas marami yung nangangailangan ng ART na married couples. But there are couples who are not married. But nonetheless, kailangan din nilang anak. And most of this can be solved or can be addressed through ART. Yes, and that is your proposal. ART lang, not surrogacy. But may I ask now the PSRM, what will we do to those couples not married or married but have failed in the ART mode or method?
Short of surrogacy, there are many experimental ways of doing it. Well, not really experimental. Depending on the situation, not all those who fail ART are for donor IVF, meaning donated eggs or donated sperm. Not everyone qualifies for that. But also for surrogacy. Those who require surrogacy are only those who have defective uterus. Hindi, kasi ang intention ng madami is that pag hindi ka nagfe-fail, pagawa mo na lang yung surrogate, that's wrong. You might have elderly couples. That elderly couple will not qualify for surrogacy because the definition of surrogacy is both sperm and egg has to come from the couple. Kung matanda na yung babae, hindi ka pa rin pwede mag-surrogate. Ang kailangan mo is donated eggs.
So, yun nga, if ART fails, yung sabi mo, ano bang ibang method aside from surrogacy?
There are now experimental methods in the works, PRP, stem cell, etc.
Okay, so these are all experimental. But surrogacy is experimental?
It's not experimental.
Yes, so in other words, ART lang talaga, at kung nag-fail sa ART, surrogacy is
It's not mutually exclusive because if a couple is elderly, they will potentially not benefit surrogacy.
Okay, so if they are not elderly?
Surrogacy can be for those with a defective uterus.
Correct. So option ang surrogacy. The problem with surrogacy is the ethical consideration. You were saying that.
The only other solution would be a transplanted uterus.
Mr. Chair.
So anyway, so my point is that I agree that kung pwede nga lang na ART, na kung pwede nga lang na ang anak ay manggagaling, so either one of the couples. Siyempre, I'm very sure 99% siguro ng mag-asawa or yung partners, mas preferred nila yon. Pero paano naman yung mga nitry na nila yon, tapos wala pa rin? And then there's a surrogacy na, which is happening right now. Right now, it's happening. And I think you mentioned that there are how many cases a year of surrogacy? We don't have that. Wala tayong around 50. Of course, it's a small percentage, but for those couple, that's 100%. You cannot put that percentage kung sa isang mag-asawa na I mean, my point is, now you were saying that, okay, hiwalay muna natin ang ART from surrogacy. But of course, the bill is pagsamahin. So it's not in our position to, unless the author would agree to that. So my point is that we have a problem. We really have a problem that, number one, we do not have a government regulatory body that regulates ART and much more regulates surrogacy. And don't you agree that we need, with more reason, that we should have a single government regulatory body to regulate it for the protection of the child, of the mother, of the couple, and of the donor? Short-term, long-term protection.
I think more appropriately, the bill should be called an ART bill because under ART is surrogacy and third-party ART and donated eggs.
Mr. Chair.
Yes, Honorable Olaso.
Yeah, lastly, going back to this old couple na gusto pang magkaanak, as you said earlier, they could no longer bear child kasi matanda na sila. So where they can get eggs and, the donors. So what if the couple have a frozen egg na nakadeposito sa laboratory for so long? Because they can afford to do that. Ibig sabihin, matatanggal na yung right sa kanila na magkaroon pa ng anak na kaya naman nilang magkaanak. Di ba? Yung point of view natin, why not give them a chance to have one? That is a very simple thing. Kawawa naman, di ba, kung gusto nila magkaroon. There are a lot of old couples who still want to have kids. Ang problema ay wala sa batas natin. Pangalawa, yung mga anak nila, after becoming professionals, they left them, they go somewhere out of country. Then, no, these people, they also want to have kids. They want that someone, to be with them, to take care of them one day. Wala napabayaan. Siguro sa next children nila, yun na lang makakatulong sa kanila, di ba? If ever that thing is happening, no. But a lot of them still want to have children. Sana bigyan po natin sila ng chance. And by this bill, I'm pretty sure to ART and surrogacy, makakatulong po tayo because we don't have in our country. This is the first bill that has been proposed in Congress. Kaya nga, sinusulong natin to because this will help a lot to our people in the Philippines. Thank you, Mr. Chair.
Thank you, Honorable Olaso.
Mr. Chair,
Yes, Honorable Castro.
do we need to file a separate bill, a bill to create this regulatory body for the ART or assisted regulatory technology? It's okay. So
In the bill now,
I
ma'am.
think also so what will be the main regulatory body that will sort of head this ART and with its laws. And I think
That-
also, Mr. Chair, the ART goes hand in hand with the surrogacy procedure.
There's a commission in the bill, Honorable
okay,
Castro. In the bill, there's a commission that is to be created to regulate the ART and the surrogacy.
So, hindi pwedeng separate yung ART from the surrogacy kasi nga, for example, yung katulad na sinasabi niya, and it's already happening, kung saan-saan kumukuha ng mga surrogate mothers
Yes.
para lang sa ganyan. And then, na-exploit yung mga babae. Like, for example, kung hindi sila pwede sa ART, edi hindi pwede mag-conceive yung mother ng young wife ng baby, so hindi rin pwedeng transplanted uterus, masyadong complicated yon. So the easiest way is yung surrogacy. Tapos what they do is, they go to far-flung remote areas like in Cebu, where they get these surrogate mothers and binabayaran lang ng kung minsan mga 100,000 or 50,000, and then after that wala na. So I think we really have to
Yes.
for the protection.
That was my point. With more reason that we should have a body, a regulatory body that should protect our poor citizens, especially the vulnerable potential surrogate mothers na madali silang babayaran eh. And they will easily agree to be a surrogate mother tapos iiwanan. And then what happens is yung ni-cite ni Dr. Novero, what if ang lalabas ay not the child that the couple expected? Bigla pa may mga congenital anomalies. Yun pala ay may hindi maganda sa expectation, short of their expectation. So, that was my point, Honorable Castro.
Mr. Chair, wala namang
Yes.
magtatanong. Kung wala na, I would like to reiterate my pending motion to create a technical working group.
Second, Mr. Chair.
So, yes, we understand the contentious issues of this bill. There have points. May mga may mga reason behind their position of those who favor and those who do not. Some have conditional. Some would like to separate the ART from the surrogacy. But to better and to have more thorough discussion and to ventilate more inputs on this bill, there is a motion by Honorable Cruz that we create a technical working group, duly seconded by Honorable Tutor, to further discuss the merits of the bill. Hearing no objection, the creation of the technical working group is now approved. We will announce the chair, or unless who would like to chair. Hindi naman niya author.
I have to
Pwede bang
chair,
author?
Mr. Chair.
Hindi pwedeng author eh. Oo.
Hindi pwede author?
Oo, hindi pwedeng author eh. Oo.
Kayo na din ulit.
So,
Ikaw na mag-chair.
or Honorable Castro would
Honorable
like
Castro.
to
Honorable Chuta.
Honorable
Honorable
Roque will chair the technical working group on the surrogacy.
Thank you.
ART and surrogacy bill. Okay? So, on that note, do I hear the favorite motion
I
that
move
we
to
always
adjourn,
wait
Mr.
for?
Chair.
So there's a motion to adjourn, duly seconded. The hearing no objection, the same is approved. This morning's Committee on Health meeting is now adjourned. Thank you very much, colleagues and resource persons.